Life with a neurologic disorder or brain injury and pseudobulbar affect can be stressful. Uncontrollable PBA episodes of laughing and/or crying can have a substantial impact on your patient's life. But treatment can help reduce these episodes. NUEDEXTA is the first and only FDA-approved treatment for PBA. NUEDEXTA is a combination of two well-characterized components, dextromethorphan and quinidine. It is important to note that while NUEDEXTA is generally well tolerated, it should not be used concomitantly with other drugs containing quinidine, quinine, or mefloquine. Dextromethorphan is a non-competitive NMDA receptor antagonist and a sigma-1 receptor agonist. Quinidine is a metabolic inhibitor that increases dextromethorphan's bioavailability and prolongs its elimination half-life so that it stays active longer. While the exact mechanism by which dextromethorphan exerts its therapeutic effects in patients with pseudobulbar affect is unknown, dextromethorphan is believed to target glutamate signaling in two key ways. Glutamate is one of the major neurotransmitters thought to be involved in PBA. First, it binds to the sigma-1 receptors, which is believed to inhibit the release of glutamate. This helps prevent too much glutamate from reaching neural receptors. Second, dextromethorphan binds to the NMDA receptor to reduce the amount of glutamate that is able to attach. With fewer activation points available, the NMDA response can be regulated when too much glutamate is released. NUEDEXTA is clinically proven to reduce PBA episodes. In the NUEDEXTA pivotal trial, a randomized placebo-controlled study, patients on NUEDEXTA had an average of 3.9 fewer episodes per day, compared to 6.8 at baseline at week 12. And according to a post-hoc analysis, patients on NUEDEXTA experienced an 82% reduction in episodes after 12 weeks. When prescribing NUEDEXTA, keep in mind that it is contraindicated in patients with a history of NUEDEXTA, quinine, mefloquine, or quinidine-induced thrombocytopenia, hepatitis, bone marrow depression, lupus-like syndrome, or known hypersensitivity to dextromethorphan, for example, rash or hives. Treating PBA with NUEDEXTA can help reduce their PBA episodes and make a difference for those in your care. To learn more about PBA and NUEDEXTA, and to access NUEDEXTA's full prescribing information, go to NUEDEXTAHCP.com. Visit our website to watch Part 1 in this series, PBA and the Brain. Indication and usage. NUEDEXTA, dextromethorphan HBr, and quinidine sulfate, is indicated for the treatment of pseudobulbar affect, PBA. PBA occurs secondary to a variety of otherwise unrelated neurological conditions and is characterized by involuntary, sudden, and frequent episodes of laughing and/or crying. PBA episodes typically occur out of proportion or incongruent to the underlying emotional state. PBA is a specific condition, distinct from other types of emotional lability that may occur in patients with neurologic disease or injury. Important safety information. Contraindications. Quinidine and related drugs. NUEDEXTA contains quinidine and should not be used concomitantly with other drugs containing quinidine, quinine, or mefloquine. Hypersensitivity. NUEDEXTA is contraindicated in patients with a history of NUEDEXTA, quinine, mefloquine, or quinidine-induced thrombocytopenia, hepatitis, bone marrow depression, lupus-like syndrome, or known hypersensitivity to dextromethorphan, for example, rash, hives. MAOIs. NUEDEXTA is contraindicated in patients taking monoamine oxidase inhibitors, MAOIs, or in patients who have taken MAOIs within the preceding 14 days due to the risk of serious and possibly fatal drug interactions, including serotonin syndrome. Allow at least 14 days after stopping NUEDEXTA before starting an MAOI. Cardiovascular. NUEDEXTA is contraindicated in patients with a prolonged QT interval, congenital long QT syndrome, history suggestive of torsade de pointes, heart failure, patients receiving drugs that both prolong QT interval and are metabolized by CYP2D6, for example, thioridazine and pimozide. Patients with complete atrioventricular AV block without implanted pacemaker, or at high risk of complete AV block. Warnings and precautions. thrombocytopenia, and other hypersensitivity reactions. Quinidine can cause immune-mediated thrombocytopenia that can be severe or fatal. Nonspecific symptoms, such as lightheadedness, chills, fever, nausea, and vomiting, can precede or occur with thrombocytopenia. NUEDEXTA should be discontinued immediately if thrombocytopenia occurs. Hepatotoxicity. Hepatitis, including granulomatous hepatitis, has been reported in patients receiving quinidine, generally during the first few weeks of therapy. Discontinue immediately if this occurs. Cardiac effects. NUEDEXTA causes dose-dependent QTc prolongation. QT prolongation can cause torsade de pointe-type ventricular tachycardia, with the risk increasing as the degree of prolongation increases. When initiating NUEDEXTA in patients at risk for QT prolongation and torsade de pointe, electrocardiographic (ECG) evaluation of QT interval should be conducted at baseline and 3 to 4 hours after the first dose. Some risk factors include use with CYP3A4 inhibitors or drugs that prolong QT interval, electrolyte abnormalities, bradycardia, or left ventricular hypertrophy or dysfunction. If patients taking NUEDEXTA experience symptoms that could indicate the occurrence of cardiac arrhythmias, for example, syncope or palpitations, NUEDEXTA should be discontinued and the patient further evaluated. Concomitant use of CYP2D6 substrates. NUEDEXTA inhibits CYP2D6 and may interact with other drugs metabolized by CYP2D6. Adjust dose of CYP2D6 substrates as needed. Dizziness. NUEDEXTA may cause dizziness. Take precautions to reduce the risk of falls. Serotonin syndrome. Use of NUEDEXTA with selective serotonin reuptake inhibitors, SSRIs, or tricyclic antidepressants increases the risk of serotonin syndrome. Anticholinergic effects of quinidine. Monitor for worsening in myasthenia gravis. Adverse reactions. The most common adverse reactions, incidence of greater than or equal to 3% and twofold greater than placebo in patients taking NUEDEXTA are diarrhea, dizziness, cough, vomiting, asthenia, peripheral edema, urinary tract infection, influenza, increased gamma-glutamyltransferase, and flatulence. These are not all the risks for use of NUEDEXTA. Please see full prescribing information.